Please welcome to the stage Dr. Jonathan Cox, Vice President of the Center for Policy Analysis and Research, the Congressional Black Caucus Foundation.
Thank you, thank you. Hello and welcome everybody. Good afternoon. Thank you for the energy, I appreciate it. So I'm Dr. Jonathan Cox. I'm the Vice President for our Center for Policy Analysis and Research at the Congressional Black Caucus Foundation, and it is a privilege to welcome each and every one of you to CBCF's 53rd Annual Legislative Conference. Now, each September, the CBCF provides this critical platform to engage in meaningful discussions about the challenges and opportunities facing Black Americans and the global Black community. Now, as the largest public policy conference focused on Black issues, ALC is a place for forward-thinking ideas, innovation, and most importantly, action. Our theme for this year's conference, From Vision to Victory, Amplifying Black Voices, is a powerful reminder of the continued need to uplift and center the voices of Black people. History shows us that when Black Americans succeed, our entire nation benefits, whether that's through social and economic empowerment, the advancement of civil rights, or the upholding of the ideals of democracy themselves. Now, this is especially crucial as we approach the end of an important election year, where turning our vision into victory relies on amplifying our united Black voices. At the Center for Policy Analysis and Research, we are fully committed to the CBCF's mission of informing policy and educating the public by providing critical research and policy insights that empower Black communities. We remain invested in our goal to foster positive change in the lives of Black people through thoughtful, relevant policy recommendations. Today's session reflects our commitment. We are honored to present a lineup of experts and leaders who are at the forefront of change, working diligently to transform policy and improve communities. We thank them for their dedication, not just for today, but for their ongoing work in advancing the cause of justice and equality. I would also like to take a moment now to recognize and thank our session sponsor, Johnson & Johnson. Johnson & Johnson is, yes, absolutely, please applaud. Johnson & Johnson is a long-standing supporter of CBCF and our work, a partnership for which we are continually grateful. Aside from their gracious sponsorship of this important discussion, I also wanted to thank Johnson & Johnson for their ongoing commitment to issues of equity, for it is only through such conscious, continued action that we can begin to reduce and eliminate disparities in health for Black people. And now it's really my distinct honor to introduce to you all our next speaker, a guest from whom all of you will really want to hear, and that is Congresswoman Bonnie Watson Coleman. That's fab, absolutely. Congresswoman Bonnie Watson Coleman is serving her 5th term in the United States House of Representatives, the continuation of a career in public service advocating for the needs of New Jersey families and equitable treatment of all people. The first Black woman to represent New Jersey in Congress. Watson Coleman is a member we gotta clap that up, we gotta give it up first. She's a member of the Appropriations Committee, and her work in the House centers on her belief that in the United States of America, there's a floor below which we should never allow any child, any family, or any person to fall. So please join me in welcoming Representative Bonnie Watson Coleman.
I want to thank Dr. Cox for inviting me. I want to thank Johnson & Johnson for always being there for the community and always thinking ahead about what we can do to create a better healthcare society, better equity, and humanity. I want to shout out to Courtney, because I'm always glad to see him. And I'm glad that Johnson & Johnson all over the world, maybe, but definitely in Jersey, Jersey-centered. Yeah. So, briefly greeting you, bringing you down here to DC to this wonderful conference. Glad to see all of you. Look forward to hearing from the brilliant panel. I see that there are a lot of brilliant Black women on that panel, and a man too. Brilliant, brilliant, brilliant. But it's so good to see brilliant Black women on the stage right now. So, data and feelings are very important. So some of the data that we deal with, there's something like, well, only 6.7% of nurses identify as Black, and like 5.7% of doctors identify as Black, and doctors that are even specialists find that they are making somewhere almost $50,000 less than their white counterparts. That's what we experience in this country. But we also know that the data, when we look at every aspect across every category, that Black folks are worse off. We have shorter life expectancy, higher maternal mortality, lower rates of health care coverage, and more barriers to accessing care. Women of color and Black women in particular not only have more trouble accessing medical services, but when we receive them, there's different treatment altogether. We're more likely to be doubted when we report our pain, because apparently we don't have much feelings. We can deal with all kinds of pain and our discomfort. And we're often met with skepticism when we want to discuss our symptoms. Our experiences are routinely dismissed because of structural racism and institutional inequities that still pervade our healthcare system in 2024. I am a cancer survivor, and I know other cancer survivors who had, thank you, yes, and I thank God every day. I know firsthand how important it is to have early access. My cancer was discovered because I was down here, and every time I was walking, I was finding myself, having a difficult time breathing. But I'm a person who's always had bronchitis, and I thought that's what it was. So I was fortunate enough to go down to the physician's office, and they said, well, let's take an x-ray. That x-ray shows something that hadn't been there before. So I'm one of the fortunate ones. I know what it is to be seen when your cancer is treatable and when your prognosis is excellent. But I know that's not what it is for all of us in this country. And I know that it's not what it should be for Black, white, particularly poor, and other minorities. I know that we have much more work to do. So when we take the time to discuss the whole issue of who's providing health care on every level, and I mean from the most basic level of keeping you in your home so that you don't have to be in the hospital, to taking care of your most esoteric illnesses and symptoms that may be rare and not often encountered, that is vitally important if we have medical providers that have lived experiences, that have mamas and papas and grandparents who had strange things happening to them, that didn't get to the doctors and died, but we thought, well, they were 80, so, that's old. That's not the way it is today. I look at my Facebook page, and there are people 110 years old, and I say, Lord, I'd like to be that if I know that I'm here. Otherwise, take me. So to spend this time to discuss the impact in our communities and truly in the larger community, to discuss the impact of having not enough diversity in our healthcare system is vitally important. When the least among us is treated with equity, respect, timeliness, and appropriate treatment, then everybody benefits, even government that doesn't have to spend money in a way that it wouldn't otherwise if everyone had access to early health care. So I thank you. I thank Johnson & Johnson for being in this space as well as others. I thank those who work in this space, and I thank those who push people like me who work on the legislative space to make sure that there are opportunities that there are economic opportunities, that there are fellowships and there are scholarships. And and that even in the mental health care area, I think that brought me into this healthcare space because I kept reading about young people thinking that suicide was an answer to their unhappiness at that time. We have so much work to do. We went through a pandemic. We've learned so much. We're prepared in a different way. Now we just need to see that there is equity in the application of the healthcare and the opportunity to be working in that space. So thank you for the work that you do. God bless you. Have a great panel discussion.
Please welcome back to the stage Dr. Jonathan Cox.
Thank you all. And so we're going to have a couple of more remarks from another one of our sponsors, but from Johnson & Johnson. But before we do that, I want to just take some time to show a short video from J&J for everybody to see.
Well, what if you don't have a primary care provider? What if you're just afraid to confess or to share a very deeply personal health issue? It is not easy for everyday people to navigate health systems. Community health workers are helping to make sense of this world. We are helping the system of care understand the culture, the history, the place, the hopes of that individual or family. Community health workers are on the front lines. They're in the soup kitchens. They're in the food pantries. They're conducting street outreach. They're driving people to their doctor appointments because it doesn't matter how I define better, right? What matters is how can I understand where you are right now and what is better for you. But the heart of what we do, the reason we do it and how we do it is centered on trust, relationship, and compassion. And in so doing, make life better for everyone. Because quite frankly, when people are not well, we all experience that in one way or another. That's how we are closing the gap between community and care.
Yes. All right, and now it is my distinct pleasure to introduce to you the next person from which you will hear, Mr. Courtney Billington. Yeah. As head of government affairs for North America, Courtney Billington advocates for policies that create more equitable access to innovative healthcare solutions for humanity. Courtney oversees Johnson & Johnson's Washington, D.C. office and collaborates with his team to advance positive healthcare reform. For more than 2 decades, Courtney has led Johnson & Johnson teams that transform markets, drive access to healthcare, and provide solutions that meet profound patient needs. Courtney is also an Army veteran, a member of the Executive Leadership Council, Alpha Phi Alpha Fraternity Incorporated, we'll forgive him for that one, Sigma Pi Phi Fraternity, and I'm also grateful to say that he is a member of the Congressional Black Caucus Foundation's Board of Directors. So please join me in giving a warm welcome to Courtney Billington.
See, there always has to be a Kappa who starts something at any meeting, always a Kappa. Good afternoon, everyone. It is so great to see this wonderful room gathered together to focus on a critical topic for us this afternoon. And before I get started, first of all, I do want to thank Dr. Jonathan Cox, who has been hosting and moderating us. Dr. Cox, thank you so much for everything you do for the Congressional Black Caucus's Center for Healthcare Policy and Analysis. He's a tremendous leader doing great things for our community. Also, I'd like to acknowledge Let's give it up again for Congresswoman Bonnie Watson Coleman. For 5 terms, she has been standing in the gap to make sure that our communities are represented and their voices are heard and being integrated into the policies and legislation that we have. So we're so grateful to have her. We're also very fortunate to have Assemblyman Herb Conaway, who is here. He is also a doctor of internal medicine. We're so fortunate to have him, and he will be moderating the powerhouse panel that we have. We thank our panelists. You'll hear more about them. But as Congresswoman Watson Coleman said, we got a super bad group of powerful women and one man, right, who's on the panel. So I'm sorry, you're going to have to deal with that all afternoon. Johnson & Johnson is so honored to be able to partner and work with the Congressional Black Caucus Foundation at forums like this to advocate and educate on issues that are so pertinent to the Black community. And some statistics may be very, very startling when we talk about the subject of health equity, our healthcare workforce of the future, especially in the light of the fact that in these next 10 years, our innovations and transformations in healthcare, we will see more in the next 10 years than we have seen in the last 100 years combined. So from a positive standpoint, the advancements in healthcare technologies are really going to transform significantly. Unfortunately, though, as you heard about some of the statistics that Congresswoman Watson Coleman mentioned around providers of competent care, we have significant shortages for the healthcare workforce of the future. When we look at over the next 10 years, actually the next 6 years, we will have a shortage of more than 10 million healthcare workers around the globe, 10 million. In this country alone, we will have a shortage of more than 190,000 nurses each and every year. There will be job opportunities that often will go unfilled, creating issues related to access to care because of the shortages that we may have. Now, some of those can be opportunities, and that's what we want to discuss today with regards to how we can increase and ensure that we have culturally competent care for those in our communities in which we live and work. Johnson & Johnson wants to see a world where the color of your skin or your zip code does not dictate the quality of care that you receive. And as a result of that, we have been working for many, many years, over the last 10 years, as an example. When you think about just the healthcare shortage that I mentioned, we have invested more than $100 million to focus on the profession of nursing, to ensure that we create greater interest in the profession, to make sure that we support those who are in the field and continue to educate and train them on the needs of our community, and to make sure that we are retaining them and that we care about their mental health and their ability to avoid burnout in jobs that are very, very demanding. So with that, the panel that we've assembled today are going to explore and discuss some of the issues, but also some of the solutions that we can have to ensure that we diversify our workforce for the future, that we increase some of those numbers to make sure that access, quality, and availability of great care is there for all. So we thank all of you. Please, we appreciate you being here this afternoon, and we look forward to the great things that we're going to hear from our panel going forward. So thank you to all.
right. Now it is again my honor to introduce our next speaker, Dr. Herb Conaway Jr., who will offer some brief remarks. Dr. Herb Conaway Jr., elected for a 14th term, has been serving New Jersey's 7th legislative district as its assemblyman for 26 years. In the 221st legislature, Dr. Conaway is a leader in the Democratic majority, chairman of the Health Committee, and a member of the Budget and Military and Veterans Affairs Committees. Dr. Conaway is the only member of the New Jersey State Legislature with both a medical and law degree, and he served as a U.S. Air Force captain in the Medical Corps at McGuire Air Force Base, as a general medical officer, and as an assistant director of the primary care clinic for the base. Please join me in welcoming to the stage Dr. Herb Conaway Jr.
Good afternoon, everyone. I can't, before engaging in my period remarks, I can't help but once again calling on you all to, with praise, to praise Bonnie Watson Coleman. I had the privilege of serving with her in the Assembly for a number of years, and certainly her guidance, keeping me on track, are important to my longevity in that job. And I hope in the months to come, I get to serve with her in another house right here in Washington, D.C. But she has been a leader. She has been a leader on the questions of this afternoon and on so many other things when it comes to making sure that all of us who live in this country have purchased and all the benefits that this country has to offer. Diversifying healthcare is crucial for improving health outcomes and ensuring equitable care for all patients. A diverse healthcare team brings a range of perspectives, experiences, and cultural competencies that are essential in addressing the various needs of a multicultural population. By incorporating individuals from different backgrounds, we can enhance the quality of care through a more nuanced understanding and communication. Diverse teams are better equipped to understand and address the unique challenges faced by different communities, which can lead to a more effective and personalized treatment plans. Moreover, a diverse workforce helps to reduce healthcare disparities and foster trust within the community. Patients are more likely to engage with and adhere to care plans when they see themselves reflected in those who are providing their care. Investing in diversity has broad implications for our healthcare system. It can drive innovation, improve patient satisfaction, and contribute to a more inclusive and equitable healthcare environment. In essence, diversifying the healthcare workforce is not just a matter of representation, but a fundamental aspect of delivering high quality and compassionate and effective care. One of the things that Johnson & Johnson needs to be praised for, and we have heard this from we've heard this already this afternoon, and that is when you bring people together, when you work toward innovation, you can achieve that by bringing in diverse perspectives. And Johnson & Johnson is leading and leaning in to this very important issue. You're going to hear from an all-star team of panelists here who are expert in this area, offering obviously data and background, also solutions for how we move forward, whether it be in magnet schools, engaging kids at young ages, making sure that we get a data set that holds employers accountable for their workforce, and moving and leaning into the kind of research that will allow us to solve this very important critical problem for our nation, because everyone, as the Congressman has pointed out, deserves to have access to quality care and to be treated the way those of us who are not challenged with either income issues or zip code issues or quite frankly, racial diversity issues, we all deserve the highest level of care that can be provided. We know that there are disparities and barriers. We need to break them down. I look forward to the discussion this afternoon. I'm sure you'll enjoy it. Enjoy the rest of the day and the rest of the convention. Thank you very much.
All right, I hope everybody has been enjoying lunch so far. And so now it's time to get to the main part of our session today, right? The discussion that I know all of you all have been waiting for. And so it is my pleasure to introduce our moderator today, a woman whom I greatly admire, Dr. Adia Harvey Wingfield. Dr. Adia Harvey Wingfield is the Mary Tilston Hemingway Professor of Arts and Sciences at Washington University in St. Louis. Her research examines how racial and gender inequality persist in professional occupations and has been published in numerous peer-reviewed journals. I can say as a former professor, I have used her work many times in my classes to teach. So again, really excited to have her here. She is the author of multiple peer-reviewed articles and books. Most recently, her book entitled Gray Areas, How the Way We Work Perpetuates Racism and What We Can Do to Fix It. And it's listed as one of Publishers Weekly's best books of 2023. So please join me in welcoming to the stage Dr. Adia Harvey Wingfield.
Thank you for the warm welcome, and I have the distinct honor of introducing the esteemed panelists who will join us for the afternoon's discussion. I'll start with Natali Duje, who is a board-certified internal medicine physician and a board member of the Dr. Lorna Breen Heroes Foundation, whose mission is to systematically reduce burnout of the healthcare workforce through well-being initiatives and funding of programs and research. She is featured in the 2022 documentary, The First Wave, which chronicles the lives of healthcare workers, patients, and their families in 2020, when New York City was the epicenter of the COVID-19 pandemic. Dr. Duje served 4 years as a full-time hospitalist and assistant professor at a medical center in New York City, and was involved in the Department of Medicine's Task Force for Racial Equity and Quality Improvement Committee. On the panel, we also have Dr. Keon Gilbert, who is a fellow in the Governance Studies program at the Brookings Institution. He is a professor in the Department of Behavioral Science and Health Equity at the College for Public Health and Social Justice at St. Louis University. He is the founding co-director of the Institute for Healing Justice and Equity, a center focused on eliminating disparities in health caused by systemic oppression. Prior to joining St. Louis University, Dr. Gilbert completed his doctoral studies at the University of Pittsburgh and was a W.K. Kellogg Foundation Health Scholar at the University of North Carolina in Chapel Hill. We also have joining us Tanya Jackson, a distinguished leader in healthcare with over 27 years of experience, who currently serves as the executive director of the National Black Nurses Association, Incorporated. In addition to her role at NBNA, Ms. Jackson is a successful entrepreneur and has received numerous accolades, including Maryland's Most Admired CEO. Ms. Jackson is a graduate of Winston-Salem State University and Central Michigan University, and is passionate about community service and advancing health equity, inspiring future healthcare professionals through her work. And finally, we have Aisha Williams, the global lead of healthcare workforce strategy for the Global Health Equity Organization of Johnson & Johnson. In this role, Aisha drives the development and delivery of strategies that support nurses and community health workers, address care gaps, and deliver better health outcomes for patients globally. With a heart for global travel, languages, and culture, Aisha's passion for diversity, equity, inclusion, and transformational patient impact has driven her career across diverse organizations and leadership assignments throughout the world. Please join me in welcoming these four esteemed panelists. All right, so the way I plan to do this is to ask the questions, throw them out, and see who answers. So I'll start with the first one. Let's start out the conversation today by laying some groundwork. What does Black representation look like in the healthcare workforce, and what are some of the major challenges Black healthcare workers are facing at the present time?
I'm happy to start us off with that question, and I appreciate the CBC Foundation hosting this session because Black representation is critical. It's shown that your level of Black representation has a direct link to the level of health outcomes in Black communities. If you look at physicians in the US, only 5% of US physicians are Black. Only 12% of registered nurses are Black. And when you look at leadership, these dynamics play there as well. In the case of nursing, all nurses of color combined make up less than 20% of leadership in administration, in professional organizations, and in education. And the impact of this lack of representation is that healthcare workers will tell you they experience systemic racism, They experience microaggressions from their patients and from their colleagues. And Black nurses and professionals in particular will say it affects their mental health. And so it truly matters. I'll dig into nursing. I speak about nursing a lot because if you've experienced healthcare, you have experienced the care of a nurse. And it's a great case study because half of all nurses say, of all colors, of all races, ethnicities, there is racism in nursing. Two-thirds of all nurses will say they have experienced it or witnessed it in the workplace. But amongst Black nurses, over three-fourths say that it has impacted their mental health at work. And as a result, you find that Black nurses report higher job dissatisfaction. They're more likely to want to leave nursing practice in the next year versus their white nurse counterparts, and that affects care for all of us. So as Johnson and Johnson, and I'm sure all the things we'll talk on the panel, it's really important to promote diverse healthcare workers entering healthcare, but having a good experience when they get there so that they can stay to provide the care that impacts our communities.
And I just want to piggyback on top of that because I represent only about 2% of Black female physicians that are currently in the healthcare workforce. And we see that, and I do want to know, I give credit to the physicians and the nurses, but the healthcare workforce is more than just that. If you look in the video that just played, there's multitudes of community workers that are essential in how I'm able to deliver care. So when there's that lack of diversity and inclusion and belonging, it makes my ability to develop and to administer critical patient care, it deters it because I'm now spending time dealing with microaggressions, telling patients, no, I'm not your nurse, or no, I'm not the person here to serve you your breakfast this morning. It limits my ability to spend the crucial time that's allotted for me to have that one-on-one interaction with my patients. I'm too busy dealing with my own mental well-being, dealing with the systemic racism embedded in a organization of the healthcare system that technically wasn't really sought out for me to begin with. So I think it is critical at this point. We see that through collaboration and through a collective voice that we are starting to make ground. And I'll talk more about that with the Dr. Lorna Breen Heroes Foundation.
So, as a nurse and as a Black nurse, and representing an organization that represent Black nurses throughout the United States, we are becoming extinct. Nursing is not the profession that a lot of nurses said, hey, when I grow up, I want to be a nurse. If you think about the lady in your community that was a nurse, we had that person to look up to in our community. We saw them in their cap, we saw them in their uniform going to work, and we said, that's who I want to be like when I grow up. However, we're not seeing that anymore. We're not seeing it. Even within our community, people look at a nurse and they say, she's just a nurse. But it's so much more to the profession. And so when we look at it and we look at it from a Black aspect, we look at so many routes. There's so many avenues to become a nurse that people really don't even know what a nurse do. They don't even know who's the nurse when you see it. And so we are experiencing that all the time. I went to Winston-Salem State University, and they taught me, it's a HBCU, they taught me how to be a nurse. They told me what I would encounter when I went out in the field. I remember my first job, and a counterpart came up and said, hey, where's the nurse? And I'm like, I'm here. No, I want to see not the aide, but where is the nurse? And I'm looking around and I'm like, I'm here. And so, that feeling, I would never forget the feeling that I had. I said it didn't matter how many degrees I had behind my name. It did not matter what school I went to. That person did not even see me as a nurse. And the person actually that was an aide, that was my white counterpart, that's who he thought was the nurse. And so, and it just made me see reality at the workplace that I see every day when I'm in my community, that I face every day when I'm out shopping. It's the same thing that we face within the healthcare system.
So I'm the guy. I had to make sure I did not go first. my black mama would have been upset had I been on this panel with all these black women and talk first. So I represent the broader public health workforce. I work in a college for public health at St. Louis University and also at the Brookings Institution. And so my work focuses really on trying to increase the pipeline of Black and Brown students in public health schools and programs by teaching, by engaging them in research. The public health workforce, especially the government public health workforce, is quite large. We have federal agencies, we have state, local, county, and even regional agencies. And some recent surveys show that about 15% of that population are Black. When we talk about community health workers, we have a much higher representation, a little bit over 30% of community health workers are Black, over 60% of them being women, about 75, 77% of them being women of color, and about 58% of them having a high school diploma or less. So when we think about sort of the diversity of the public health workforce, folks who are working as community health workers, we really have to think about where are the training opportunities for those individuals to enter the workforce. Some of it is schools and programs of public health, some of it is through community colleges. What really needs to happen is doing a landscape analysis in your community about what are the health needs of that community, what is the diversity of the public health and healthcare workforce in those communities? Is it representative of the communities that are of your community? And what types of programs can we really start focusing on and enhancing to make sure that the diversity of that pipeline increases in a number of different ways? Becomes critically important to be able to do that as this illustrious panel has already mentioned, in terms of that workforce being critically responsible in reducing healthcare disparities. Some statistics show that having a diverse workforce in particular can reduce maternal outcomes by at least 20%, right? And so when you think about the impact of that, it becomes really important to sort of think about where are our resources going to increase that pipeline.
Great. So all of you have touched on this question of diversity in one way or another, but I also want to talk about making the healthcare workforce more inclusive. This can be challenging in light of some of the recent efforts to diminish or even outlaw DEI practices like HR 7725 or the Educate Act. And this seeks to prohibit graduate medical schools from receiving federal funding, including federal student loans, if schools adopt certain policies and requirements related to DEI. So I'd like to hear from you about how we can strengthen the healthcare workforce by making it more inclusive, not just more diverse, so that healthcare professionals are better supported.
So I start, and does everyone know what the Educate Act is? So basically, it is a legislation that says that if a college has DEI efforts or anything that is about DEI, then the medical doctors, if they give it to their medical doctors, then all federal funding, grants, scholarships will be eliminated. So when you think about that, if you look at a school, a medical school that is housed with nurses, with public health workers, with other majors that are in the healthcare field, that's going to affect the healthcare workforce and not just the medical doctors. So now we're going to have more health disparities because we're not going to have these schools that's training on DEI. DEI is essential. It is essential for someone to treat our populations. So our marginalized, hard to touch, hard to reach populations, they're not going to have anyone there because a school is not going to be able to train because they're not going to get the funding. If we look at HBCUs now, it's only 4 HBCUs that have medical schools. 4. We have some that's on the horizon, but right now we have 4 HBCUs that train our doctors. So this legislation is really going to impact not just medical doctors, but it's going to affect the whole entire workforce.
I want to use an analogy that is actually from the Race Forward organization about how DEI initiatives and programs in a lot of these healthcare institutions are presented. If you look at a cinnamon raisin bread, Right now, DEI initiatives and programs, a lot of them tend to be the raisin, where if it's not palatable, you can pluck it out. You can decide you don't like it and take it out. But in reality, DEI is another way of saying belonging in your true, authentic self. In order to do that, you need to be the cinnamon, where it is embedded in everything that the institution does. In order for us to do that, it's not just an office of DEI. It's in terms of the diverse hiring panel. Who is in our leadership roles? It's in our who are we allowing in spaces to have access to go up this pipeline that a lot of um, programs have initiated. So I think we need to reconfigure because DEI has now become a polarizing statement when in actuality it's just how can we feel belonging in a space where I can show up not just as Dr. Duget, but Natalie Duget, the sister, the daughter, because we are more than just our profession. When we show up in our healthcare space, in order to connect with our patients and to individuals, we need to be empathetic to our lived experience. So I think we need to reframe that. And I have to give credit to the Dr. Lorna Breen Heroes Foundation, okay? They've been working really closely with Johnson & Johnson. I see a lot of our member like from Johnson & Johnson here, which I am incredibly grateful because I'm also seeing their efforts because I'm still a practicing physician. We're seeing that for the first time ever, we have the Dr. Lorna Breen Healthcare Provider Protection Act that is federal funding out there to give grants and funding to institutions like HBCUs, to institutions throughout the nation to help support the well-being of the healthcare workforce. We have programs already in the pipeline that we like. It's called All In Caring for Caregivers with that the foundation has started because I like analogies. Sorry, guys, we have the tools. We know what needs to be done. Just like working out, we have plenty of exercises that we know that could be beneficial for us to achieve whatever strength training or losing weight, but we don't have programs that implement. The All In Caring for Caregivers, we now are like the personal trainers for the CEOs, for the leaderships of these healthcare institutions to realize how we can implement these resources that are already out there. It's that's the true thing. One legislation won't be the end all be all. So I don't want this Educate Act to be because guess what? Affirmative action that definitely got repealed, but we still have Black students. We still have people being enrolled. Definitely not as much. There has been a decline, but we do need to reframe what we think when we think of diversity, equity, and inclusion, and more of a belonging of I belong in this space.
I would just build on that implementation point because so many of the solutions of how to make these workplaces more inclusive, you don't have to look any further than the expertise that's in your healthcare system. So,
Exactly.
speaking about the Lorna Brain All In Act that we're very proud to support, it's about making the best models for a more inclusive workforce systemic. And it's a resource that I would encourage others to reference. It talks about how to use nurse leaders to create their own solutions, nurse led innovation. They're caring for people day to day, they experience this day to day. So J&J has, as an example and an extension of some of that work, our J&J Nurse Innovation Fellowship, where we work with nurse leaders sitting in health system across the country and equip them with the type of innovation expertise to sell their ideas into health systems and make a difference. We have a nurse practitioner entrepreneurship program with Duke Health that takes nurse practitioners and gives them business acumen to be able to open up practices in their communities in resource limited settings to bring primary care and mental health care to the community. So I'll say all that to say you have to implement, but bring in this community of rich, diverse healthcare workers as part of those solutions because there'll be better solutions to impact care.
If I can just add a couple of points. One of the things that becomes really important is for all of us, for all of you to get involved in your alma maters, for you to be part of admissions committees, for you to be part of board of visitors, all of those things, because likely you can have some influence on who gets admitted into programs. The same thing with when you're in a particular workspace, being part of the hiring committees. Because if we are not at these tables examining applications, looking at candidates, we will see different things or identify different qualities and characteristics that other folks will not notify, or they'll think that is a weakness in their application. As a person that's been on admissions committees at my university and other places, it happens all the time. Students, black students, brown students, lower income students, or students that come from HBCUs often get ignored and their applications get pushed aside. It really becomes incumbent upon us to be a part of these types of committees to be able to not only represent ourselves and the folks from our communities, but to bring a very different lens and way of thinking about applicants to make sure that they are even in the pipeline at all.
I just want to add one thing. I think sometimes we need to go past the DEI statement. A lot of times we feel, oh, let's implement a statement, and that's where we have a statement, and that's it. Or let's hire someone of color to be our DEI officer. It's so much deeper than that. As my fellow panel colleague said, it's about belonging, being a part of the organization. So try to push past that DEI representative or that statement and get deeper into what the issue truly is.
So that actually leads well into the next question, which is about cultural diversity training. What role could this type of diversity training or cultural competency have on health personnel when dealing with employees of color? What can we do to make sure that these trainings are effective, but also that they're responsible?
So I'll start. We really need a pedagogy of equity, not just in universities, but in workplaces. And I say that above and beyond cultural competency, cultural awareness, whatever sort of the phrase is. If we think about a pedagogy of equity, that can be infused in all types of training, whether again you're at an academic institution, a workplace, and thinking about sort of identifying core tenets and principles and making sure that that is integrated in the workforce. I had the privilege and pleasure of working with a project that we looked at ways that public health agencies and other government agencies were implementing anti-racism in their workforce, and the ways that they were training their staff, training individuals to think about anti-racism practices and principles and to be more inclusive. And one just quick example in Seattle, some folks were giving us an example about some of the work that they've been doing and how that led to a transformation in a housing facility that they were operating. They were doing some repairs in the building, and they needed to communicate with everyone in the building about how the repairs were happening. And because of their training around anti-racism, they were able to communicate with everyone in different languages, different ages, to make sure that everyone was safe. And they reflected on that moment as being a small win, but an important win in terms of how they operated, how they changed their practices and principles in the day-to-day operations. And so those are the kinds of things that we want to see happening over time.
I just want to add in terms of how the cultural training is being implemented or dispersed within the institution. I know personally a lot of these trainings can be online questionnaires, online testing, where, to be honest with you, my white counterparts will never know the feeling of what it's like to have to deal with racism. That's something that just won't be there. So I think a lot of this training needs to take away some of the entitlement. As a physician, I'm aware that I have some type of privilege and entitlement that comes with my profession, and strip down to the humanity of individuals. That may need to be simulation, taking these trainings outside of the healthcare institutions' buildings and more into the communities at which they serve. And I think that needs to be one of the ways these trainings can be better received and better understood than simply let me read it in a book, let me answer some questions that we think is societally appropriate or not controversial. So I think, once again, reframing of how we think of cultural competency, because my lived experience as a Black physician born and raised from the Bronx, which has some of the worst health outcomes, okay, may be different from my colleagues who's from a rural area from Mississippi, okay, that I don't know that experience, but yet there is a commonality when we strip down the privilege, the entitlement, and then we start realizing we have the same lived experience of grief, of loss, of disappointment, of frustration, to take that moment to then realize how I showed up to work today is because of a multitude of factors outside of what I do for a living.
I,
I think one of the things that we need to look at is we do a lot of our training as one-stop shop or as a one-off training. This is something that has to be continuous and it has to be embedded in the organization, and the organization leadership has to be committed to this. Our local, our state, and our federal legislators have to be committed to this ongoing issue, not when something happens or not when someone doesn't receive care and it has the news press. It has to be embedded. And my grandma always said the learning is in the doing. And so, as my fellow colleague just said, it has to be. We have to practice it, and it's not just me. I don't need to practice. I experience it every day, But our white colleagues and other colleagues, they need to experience this, and they need to practice it and see it in real action on how it works and how the patient or the population is feeling. So again, I like to just leave real short. The learning is in the doing. So.
I would just add that the commitment from the top is critical as we support health systems across the country. This is no longer optional. If you think about our country, 100% of population growth in our country is multicultural. We're not going back. This is where we are. And so, if we are committed to care as leaders, as health system leaders, practitioners, we have to be comfortable. We have to make it continuous. We have to get out into the community. So it's just so central to where we're going. You cannot give care if you're not giving inclusive care. And that's a message that has to come from the top as well.
If I could just add one more example, and this really underscores the importance of community and making sure that community is involved, making sure that community has a voice in decision making. So before everyone leaves the lunch, I'd like for everyone to look up the Greensboro Health Disparities Collaborative. They are an excellent example of a grassroots organization that saw a problem in their healthcare system, in particular, cancer center. So they started with a very small research project, pilot project, because they noticed differences in breast cancer disparities. They started with interviewing Black and white women to understand the quality of care that they were receiving from one particular healthcare center, and they expanded a project to integrate anti-racism training and accountability. So what they did was that they developed a system with that hospital, with that hospital, to be able to track and monitor breast cancer patients and lung cancer patients and the physicians that were treating them, also the staff, because they recognize it's not just the physicians, it's also other staff involved in the healthcare system. And so they were able to provide real-time feedback to physicians and others working in that particular center as a way of understanding, well, if this Black patient didn't return in 3 weeks and this white patient is coming back in 1 week or whatever the time frame is, why is that happening? And what are we going to do to intervene? And so they use community health workers, lay health advisors as a way of being able to implement an accountability system. And so it took the community to identify that problem and to sort of work through and identify a solution.
Thank you. I want to ask you all to think a little bit about the healthcare system writ large, which is very broad and complex. It ranges from public to private spaces, hospital systems to local clinics, and federal to state and local jurisdiction. But most of us may only think about the pieces with which we interact. How does the issue of diversifying the health workforce vary throughout this complexity? And what's important to consider from different perspectives? And Dr. Gilbert, I'd like for you to start us off with this one.
Yeah, so I mentioned a few examples already in terms of thinking about how do we become more inclusive. Um, a lot of it really does take thinking about what's the top down approach, what's the bottom up approach, and sort of what happens even in the middle. And so as we think about how do we transform our organizations, whether it's universities, whether it's healthcare systems, and thinking about, again, sort of what's the role and what's the input and influence that community has. Because ultimately, what we are doing is we are serving communities. And if they are not having any input in terms of what that training looks like, what the services are that they need, then we're really missing the mark in a number of different ways. Oftentimes, we hear from mentors and communities from our students that are doing internships. They will tell us flat out those students were not prepared. Those students did not have the skills to be able to do the work that we were asking them to do, and that's on us, right? So it becomes really important to think about what are the transformative levers within all of our systems and organizations to be able to be more inclusive to diversify the workforce ultimately.
I think one thing we have to recognize that the healthcare system is complex. So if we look at Washington, D.C., and look at maybe Washington Hospital Center, it's not the same as the rural hospital in North Carolina that my parents go to. And so we really have to look at it that, a lot of times people look at healthcare and they look at the part that they interact with and not recognizing that it's vast. And so when you think back about the community and you think about the population, you have to put that population at the center. A lot of times we put the treatment first and not the person. So we have to go back to treating the person and what's going on. What are the barriers? What is stopping them from being compliant with their medication? What is all these social determinants, these social drivers that's stopping them? And we have to, and to diversify the workforce, we need that community health worker. We need the doulas. If you look at maternal health and you look at the Black population, we measure up to like a third world country. I mean, the stats are there. Our people are dying. They're suffering from pain. They're going through all of these things that they don't have to go to if they was just treated with kindness. Or number one, if they spoke up. A lot of times they don't. The patient does not speak up. So when you look at diversifying the workforce and you look at that complex health system, you need someone that can help them navigate through. You need that community health worker. You need that doula. I want you to think about, and I keep going back to the community, if you can think about the person in the community that would, like, we had a Miss Bell. Miss Bell helped everybody. She took everybody to the doctor, the people that couldn't go to the doctor. She cooked for people to make sure that they was eating. She even babysat sometimes. That is what that community health worker is. That is what that doula is. And that is what they're bringing it back to. We have to stop looking at the way we do traditional medicine, modern medicine, and really look at the person and how that person is going to get better, because we're going to continue to have disparities if we do not look at this and if we do not really address it.
I just, excuse me, I just want to add because I'm a traveling physician. I was trained in Montefiore Medical Center that's in the Bronx, but then after COVID, I was burnt out and I quit and became a locum tenens physician. I have worked in Montana, Helena, Montana. I have worked in Evansville, Indiana. I have worked in a lot of smaller towns. What I've noticed now, because I now have a different perspective that I never had from training, and even from my working in an academic center. The healthcare system is definitely complex, but it's siloed. What the pandemic did, COVID-19 pandemic did for the first time, hospitals had to talk to each other to figure out how are we going to get resources, how we're going to get the staffing, how are we going to get the equipment to deliver the care that was optimal and critical to kind of get ourselves outside past the pandemic. The issue is these institutions that claim they're so under-resourced, it's because they're not talking to each other. It was mind-blowing to me. I was at the height of the pandemic in New York City in 2020. I worked through it all. Then in 2021, I was in Helena, Montana, small town. That was their height of the COVID-19 pandemic. And it was mind-blowing to me that they didn't have medications that were available across the nation, but they were not accessible. you start seeing that it's healthcare institutions and these leaders that need to have collaborative efforts, and not just with healthcare institutions. Like I said, Johnson and Johnson, you have showed your commitment to the Black community, but we also need to know that there are other organizations, maybe like the JP Morgan Chases, maybe like some of these other whatever, like the NBA, whoever has the means to get the resources needed to deliver care. Because guess what? There's a high likelihood that throughout your lifetime, you're going to be introduced into the healthcare system, whether it's directly as a patient or through by a loved one. So it is critical that that collaborative force that we're starting to see more of, where you have a small organization like the Dr. Lorna Breen's Hero Foundation that started in 2020 by two individuals, Jennifer Feist and Corey Feist, when Jennifer's sister, who was an emergency medicine physician, died by suicide. Because of the mental health burden that healthcare workers have to endure, that unfortunately we see that way too often in the healthcare system. But the efforts of starting with two people have expanded, where the Dr. Lorna Breen Heroes Foundation now works with Johnson & Johnson, now collaborates with the National Black Nurses Association, that now collaborates with a multitude of organizations where we helped get the Dr. Lorna Breen Healthcare Provider Protection Act passed, which is now up for reauthorization. So please talk to your congressmen, congresswomen, because we need this. As someone who's still practicing as a physician, it is a day-to-day effort to show up sometimes. It's a day-to-day effort to be able to still have that vulnerability, to be able to give that equitable care, to be able to give the attention that patients need and deserve. If I can't help others when I need help myself. So I think it is critical, yes, that bottom-up approach. I have my self-care routine. I am more cognizant of what I need for my own personal health, but it can't happen if my workplace schedule isn't flexible. It doesn't happen if I don't see leadership that looks like me, that understands some of the things that I have to endure. It doesn't look like with the economic disparities. Let me not tell you about my student loan debt that I'm still paying. So I think there is both a top-down and bottom-up approach, but it's a collaborative effort that needs to be done within healthcare.
So I've been getting the signal that I've been getting I don't know if you remember the Chappelle Show, the Wrap It Up box, but I've been getting a version of that. So I'm going to ask you all, final question. I'm going to ask everybody to keep it brief at under a minute for your answer so we can make sure we can conclude on time. So what I want to hear from you now as your final remarks in just under a minute is to name one policy that you'd like to see implemented to support Black medical professionals across all levels, and to give one quick piece of advice you would give to a Black student pursuing a degree in the healthcare field that you wish you knew when you were first starting out.
Don't go to me first. Let me see.
I won't speak to a policy, but a concept, if I may, but I'll do it in the minute. As corporations, as industry, we have tremendous opportunity and obligation to help with everything that we're talking about. And what I would suggest is to look at it across the healthcare worker spectrum. Support young students to understand STEM and nursing and healthcare careers. Support students who want to go to school with mentorship and scholarships. Support these leadership programs and partnerships with organizations to help upcoming diverse leaders get into those positions where they can make a difference so that we can have sustainability in our system. And to young people who are looking, I would say, visit nursing.jnj.com if you're interested in nursing, where we scan nursing scholarships across the country and put it all in one place. If you're looking for your state, if you're looking for a specialty, if you're looking for undergrad or grad, we do that, but many organizations do that. So tap into the resources to make it easier for you to get to where you want to go.
I would say if I could change one piece of legislation, I think about the mission, and the mission is to really eliminate disparities. So the expansion of Medicaid for those hard to touch communities, really looking there and not just looking at it as look at the benefits. If I could change the legislation on what we're doing for those communities. If I could speak to a student and give them advice, I would say that as a Black nurse, because I'm giving advice, I am a nurse, that you can't show up as yourself. You have to show up as Tanya, the Black nurse, or whomever the Black nurse, because that title is going to go with you. So always know that people are looking and that you have to not only prove it to yourself, but you do have to prove it to them, and you owe it to the population that you're taking care of.
Um, Thank you. Uh, so one policy I think that can actually change and shift a lot of things is changing some of the requirements of our public health agencies, funding agencies in particular, to be able to actually give grants directly to community-based organizations. There are lots of barriers in the federal government agencies in being able to do that. The community-based organizations are doing incredible work. They cannot access resources from federal government, certain agencies, because of the rules and policies. So those are even intra-organizational policies that can change and really make a huge difference. Advice to students: I'm a person that was planning to go to med school, had a sidetrack and through a study abroad experience and ended up in public health. And I offer that as there are many pathways into healthcare, public health workforce. There are maybe folks who are interested in business and accounting, and they may have some very interesting models in terms of how we change payment. And so thinking about sort of the intersections of this complex health and public health workforce and the systems, to think about sort of their particular role in being able to change and shift health disparities in a different way from their own disciplines.
The type of policies I would want to see, particularly for institutions, actually, I'm not going to go from a federal or workplace policies that are flexible. A lot of people are unable to pursue higher education because of the limited restrictions in the workplace, whether it's allowing for remote. Sometimes not everybody needs to be in the office to be able to go to work, because sometimes you could be at home and still get the job done, and then you're able to have extra time to do the education to then proceed of that. Flexibility in scheduling. People have a lot of responsibilities outside of their job. When you allow for flexibility, that's why I actually quit my job and became a traveling physician, because it allowed for me to show up more for my family that I wasn't able to do so, even though I was living in the same city. So I think really implementing workplace policies that are cognizant of some of the social determinants of health, because if I'm doing long hours at work, it's a matter of time before I'm gonna be in the hospital. So I think we really need to be on that. And then for my future doctors, I'm gonna speak on us. A lot of us come into this field because we wanna help people. You're part of that people. Seek the help that you deserve. You owe it to yourself. That's something I would definitely drill into anyone that wants to pursue this career.
Great. Thank you all. Let's please join me in thanking this panel for their insightful remarks.